Hey everyone, I am going to talk today about Mind Solutions. It's a private outpatient mental health and substance use treatment clinic that I work or that I've been doing my internship at. It's brand new, so there's like a lot of stuff still changing. They just started in 2020 during the pandemic, so there was a lot in flux during the height of the pandemic, and there's a lot still changing. Social problems that we're addressing directly: mental illness and substance use. We have one-on-one therapy, group therapy, and medication assistant treatment program, which is provides supervises the treatment, which is uh, buprenorphine for people who have opioid use disorder, and um, we also offer some other services such as case management, group therapy, peer support, and so on. So, social policies, laws, and practices that impact the system, all the practices that impact health care generally. So, that includes HIPAA, which has to do with um, the way that we protect people's health information, and then fraud, waste, and abuse practices and policies. Then more specific, there's like state level stuff, which has to do with, the policies that create our state insurance. Oregon has state insurance called Health Share. It's a really robust program. So participants in, or our clients who are able to see us have often don't pay anything as a copay, and some people qualify for free transportation and rides to their healthcare appointments. So there's some policy stuff there that's impacting our clients. And then also other policy stuff that's impacting our clients is housing policy. So in Oregon, there's a lot of new policies coming up in Portland specifically. There's like a lot of legislation around homelessness coming out in the last couple of years, and a lot of government spending dedicated to addressing homelessness. Other things that uh, impact our clients would also be criminal drug laws. So in 2020, Oregon also voted to uh, decriminalize the possession of all drugs, which has a big impact on our clients as well. The agency I work at is a private for-profit organization, so there's no board of directors and there are no investors currently. Um, the major programs are a mental health program, a substance use treatment program, and the medication assisted treatment program. Um, Currently, the only funding is in the form of insurance payments for services rendered. Um, Most of our clients are insured through the Oregon Health Plan, which is state Medicaid, but we also accept Providence, MODA, and Blue Cross Blue Shield. The CEO of our organization is Jermaine Mason. He's not a doesn't have a background in mental health. He's a businessman, but he grew up in the neighborhood and wanted to do something to give back, so he started this organization. He works closely with Melinda Del Rio, who manages the staff of the mental health programs. She also does a lot of the business operations stuff. And she establishes and maintains all the policies of the agency. She hires the new staff. She trains and supervises all the mental health interns. And she's kind of an all around, kind of like knows everything about the organization. And then there's Kate. She manages the medication assisted treatment program, and the substance use program currently does not have a manager. Um, there's no staff positions for the intern program. Interns just are supervised by the manager of the program that they're interning with. The mission of the agency is to provide diverse patient-centered care and wraparound services to help patients reach long-term recovery. Currently, the individual programs within the agency don't have their own goals and objectives. They all kind of work together towards this bigger mission. As mentioned above, we have a partnership with OHSU to staff the MAT program with a registered nurse. We also have um, established relationships with other mental health and human service organizations around Portland. So we receive referrals and send referrals to organizations like the Urban League, some rehabilitation centers around town, transition projects, Cascadia Healthcare, and others. The service delivery methods and models we use in the mental health internship program are case management, skills development training, and facilitating therapeutic groups. I did not find any information about skills development training. This is like a thing that I do where I sometimes call clients and kind of coach them around emotional skills or kind of working coping skills, but I couldn't find any research specific to that, and I don't really know what if there's another name for that model. But I did find good evidence that case management can improve outcomes for people experiencing mental illness and who are in treatment. And also, I'll be running a anger management group later this month. And I found a lot of evidence that, especially CBT based anger management skills training, is a really effective way to teach people the skills to manage their anger. Right now, we don't have anyone tracking data in the intern program or kind of at all in the agency. So accountability takes the form of a weekly supervision meeting that I have with Melinda, my supervisor, and then there's a weekly group supervision meeting that's attended by all the therapists and interns.